Now, the one thing I didn't show you is the aperture. Now, this dial here changes the aperture. Now, your pupils, because it was dark in here, were really, really dilated. Now, this is how we measure. Now, when we talk about a diopter, what we're talking about is, you see all the gradations there? So if something's 2 diopters out, it's 2 gradations out.
Oh, I see.
It's kind of hard to see. See
I
that?
see. Yeah, I see.
Yeah.
That's cool.
And we can put a direction to it, nasally, temporally, superiorly, inferiorly. You are not ready to do that. Don't even worry about it. Now here is a big aperture. This is a good place for you to be. Big window, dilated pupil, big aperture. So we change the aperture on this dial, and we change the diopter, or the focus, on the one on the side, okay? Now, that's your little test for the retinal exam. Now let me do the external exam. Now the eyebrows and eyelashes are fully distributed bilaterally. There's no ectropion. Now what is ectropion? Eyelashes everted, no entropion, turned inward. Okay, good. Now I'm coming in and I'm going to look at the conjunctiva. Now I have an abnormality, but I'm going to finish your exam and then you can tell me what the abnormality is. Now, look up. Now, the palpebral conjunctiva is clear, it's pinkish red. The bulbar conjunctiva is also clear, the sclera is white. Now I'm going to move in. Now the limbic margin is clear, the iris is brown. Can you hand me the ophthalmoscope? Now I'm going to do the corneal reflex, the corneal exam. Now, here we go, big, big. Okay. Now just look straight forward. Now the side of the cornea should be clear. Now I don't have to put my eye to the ophthalmoscope. The cornea is clear in the anterior section, so the cornea is clear. Now what should I be doing next? The direct and consensual reflexes, because I've got the light here. So, okay, so both eyes constricted. So his pupils are equal, round, and reactive to light. Now at this point, we get all of our fun tests. Now, could you look up at the light? Now the corneal light reflex to me looks like it's at 10 and it's symmetric. I don't suspect that he has strabismus, but I'm going to do the cover test anyway. Now, can you cover your left eye, please? Now, will you look at my finger? Now uncover the left eye. So both the eyes were conjugate, so we saw no movement. So there's no phoria, there's no tropia. Now we can have some more fun. So I'm going to do the cardinal motions.
Do I need my glasses or no?
Pardon?
Do I need my glasses or no? My glasses?
Actually, yeah, let's put our glasses on. That might help us. Now I'm going to do the H, just to remind you. So right 3 superior, right 3 inferior, 3 medial. Right abducens, that's cranial nerve 6. Now I'm going to focus on the left. Okay, 3 superior, 3 inferior, 3 medial, 6 lateral. Now, 3 things in once, right? Accommodation, convergence, and cranial nerve number 4. Now the trochlear nerve, actually the pupils are getting smaller, so he converges, accommodates, and cranial nerve 4 is intact. Now when you become more advanced and you can really honestly say in your heart, you know what you're testing, you can do something like this. Now follow my fingers. 1, 2, 3, 4, 5, 6, 7, 8. But at this point, if you're going to do that, I'm going to test you in midterm. Okay, what were those nerves now? Okay, so that would be your cardinal movements. Now, let's do visual fields by confrontation. Now, if you could cover your left eye, please. Oh.
Yeah.
Now, when you see my fingers, let me know.
Now.
Okay,
Now. Now. Now.
so 50, 90, 60, 70. So visual fields by confrontation within normal limits. You'll do that on one side, and you'll also do the EOMs on one side for me for the testing purposes. Okay, so actually we've had a lot of fun, but now we need to do some visual acuity things. So maybe I'm lucky, and I'm gonna find a Jaeger chart here. Oh, I hope so. I'm unlucky. Ah! Okay. I'm very unlucky. Let me go look for one, and I'm just going to pass that around. Look at the right-sided margin. It has the same markings that you would see on a Schnellen. Now, we have a Schnellen at the end of the hall. Some of you may want to try that for real, because it's good to know. So we hold this at 14 inches, and that's why I want his glasses or corrective lenses on to do this.
Even if it's for farsightedness, right?
Absolutely,
Okay.
absolutely, because what we're trying to do is we're trying to see if the lens is correct to the 20/20 or 20 out of 25. 20 to 30 isn't really acceptable because that tells us that you do have a requirement for a finer gradation. Yeah. All right, now why don't you shield or cover up your left eye? We'll hold this at 14 inches and read the finest line that you can. Now, which one?
I can read the bottom one pretty well.
Okay, this one? Okay,
Yeah.
go ahead.
4, 2, 6, 7, 3, 9.
Perfect. So his vision is 20 out of 20. So that's perfect correction. So you would do right, left, both in the real world. And this is kind of a crude substitute for the Schnellen, but it's the same idea.
Mm-hmm.
Does that make sense? So you might want to try the Schnellen today.
Is this the
So
hall again?
we've done the vision, and then the next thing is we would want to do the retinal exam, right? See how easy that is? I think your biggest challenge today will probably be how to hold the otoscope and not kill your partner. And the second big challenge is, I hate to say that, but that's true. And the second one is how to focus on the pupil, is getting that right. So I would recommend practicing this way, maybe starting at 6 and then going down to 0 to see exactly what your numbers are, all right? So I'm gonna do one more demo down at the end of the hall. Pardon me.